You go to the pharmacy, look over your shoulder, and quietly buy another tube of hemorrhoid cream. You tell yourself this is just temporary. Just until the itching calms down. Just until the bleeding stops. But then weeks pass, maybe months, maybe years. And the pattern keeps repeating. The swelling returns. The discomfort returns. And that bright red blood shows up again. And if that is your life right now, I want you to hear this clearly. You are not weak, you are not broken, and you are definitely not alone. Hemorrhoids are not some bizarre failure of your body. They are normally present vascular cushions in the anal canal that can become swollen and symptomatic when pressure rises. They are commonly linked with constipation, prolonged straining, and spending too long on the toilet. Before we go any further, I need to say this exactly and plainly. This video is for educational purposes only. If you experience rectal bleeding, you must see a doctor to rule out serious conditions like colorectal cancer. Do not self-diagnose based on a YouTube video. That matters because rectal bleeding should never be brushed off automatically as just hemorrhoids. Even when hemorrhoids are common, the symptom itself still deserves proper medical attention. Also, many hydrocortisone hemorrhoid products are not meant for long-term use. Labels and guidance commonly say to stop and ask a doctor if symptoms persist beyond 7 days, return quickly, or if rectal bleeding occurs. Now let me say the part that most people never hear from the pharmacy shelf. Many over-the-counter hemorrhoid creams are designed to quiet symptoms, not solve the underlying problem. Hydrocortisone can reduce inflammation, redness, and itching for a short period. That is why it feels like relief. But relief is not the same as repair. And here is the warning. These products are generally meant for short-term use, not months or years of repeated daily application. When people keep reaching for them over and over, they may be covering up a deeper problem instead of fixing it. That is where the trap begins. So what is really happening underneath all that itching, swelling, and bleeding? You are not dealing with random tissue gone bad. You are dealing with pressure. Repeated pressure. Internal pressure from constipation, straining, and long toilet sessions. Over time, that pressure keeps forcing the vascular cushions in the anal canal to swell and become irritated. That is why this conversation cannot stop at the tube of cream. If you only treat the surface, the problem keeps coming back. In the next section, I want to show you exactly how that pressure works, why the tissues become so vulnerable, and why the quick fix people trust most may be helping the cycle continue. Let's start by taking the shame out of the word. Hemorrhoids are not weird growths and they are not extra tissue that appeared out of nowhere. They are normal vascular cushions in the anal canal. A mix of blood vessels, smooth muscle, and connective tissue that help support continence and the closure of the anal canal. They become a problem when those cushions swell, slide downward, and start behaving like irritated, overfilled tissue instead of stable support structures. That is the important shift. You are not looking at a random defect. You are looking at a pressure-sensitive structure that has been pushed past its comfort zone. When pressure rises, those cushions can engorge, and that is one reason hemorrhoidal symptoms often flare during or after bowel movements. The main driver is not mystery, it is mechanics. Chronic constipation, hard stools, straining, and prolonged time on the toilet all increase pressure in and around the veins and cushions of the anal canal. NHS patient guidance and hospital leaflets consistently warn that constipation, straining, and sitting on the toilet for long periods can make hemorrhoids more likely or worse. And this is where many people get trapped. They treat the symptom while leaving the pressure in place. If the stool stays hard, if the evacuation stays forced, and if the toilet habit stays prolonged, the cushions keep getting slammed over and over again. The body never gets a chance to quiet down. When the tissue is repeatedly stretched and congested, the surface becomes more fragile. That is one reason hemorrhoids can cause bright red bleeding during or after a bowel movement. Internal hemorrhoids often present with bright red blood on toilet paper, on the stool, or in the toilet bowl, and they are often not painful unless they prolapse. That bright red color matters because it usually points to bleeding close to the exit, not deep inside the digestive tract. But it still cannot be assumed away. The symptom may fit hemorrhoids, yet rectal bleeding always deserves proper medical assessment rather than self-diagnosis from a video or a cream label. Here is the part most people never hear clearly enough. Hemorrhoids are partly a support problem. Their tissue contains connective tissue and muscle designed to help the anal canal stay sealed and protected. When repeated pressure, straining, and congestion keep beating on that support system, the cushions can enlarge, descend, and become symptomatic. So if you are asking, why do I keep getting the same flare again and again? The answer is often simple. Because the internal conditions that create the flare are still there. The stool pattern, the toilet habit, the pressure pattern, and the vascular stress pattern are still active. That is why topical relief alone rarely feels like a real solution for long. The problem is mechanical, digestive, and vascular all at once. In the next chapter, I'm going to show you why steroid creams can make this worse over time. Not by causing hemorrhoids, but by making already fragile tissue less resilient. Now let's talk about the steroid trap. Over-the-counter hemorrhoid creams with hydrocortisone are not magic tissue repair creams. They are anti-inflammatory steroid products. They can temporarily reduce itching, redness, and swelling, and they also have vasoconstrictive effects that can make the area look and feel calmer for a short time. That temporary quiet is exactly why people keep reaching for them. But temporary symptom relief is not the same thing as restoring tissue strength. And because these products are intended for short-term use, the label itself warns people to stop and seek medical advice if symptoms persist beyond a week or if rectal bleeding occurs. That is not a minor footnote. That is the manufacturer telling you this is not a long-term daily maintenance product. Here is where the real danger begins. With repeated topical steroid use, the skin can gradually become thinner and weaker. Medical reviews describe steroid-induced skin atrophy as thinning of the epidermis and dermis, with reduced collagen support and changes in the connective tissue that normally give skin its strength and elasticity. In plain English, the scaffolding starts to wear down. That matters especially in a region that is already under pressure, already irritated, and already prone to friction. If you keep applying a medication that lowers inflammation but gradually weakens the local tissue support, you can end up with skin that is more fragile, more easily irritated, and less resilient when the next bowel movement creates strain. When connective tissue is weakened, small surface vessels and delicate tissue layers become easier to irritate and easier to injure. Reviews of topical corticosteroid adverse effects describe visible thinning, easy bruising, telangiectasia, and purpura as classic signs of chronically steroid-exposed skin. That is the visual clue that the supporting structure has been compromised. So when someone says, "The cream helps for a while, but then I bleed again," that pattern deserves respect. The cream may be calming inflammation temporarily, but if the tissue is also becoming thinner and the underlying pressure problem is still there, the flare can come back faster and feel more fragile than before. That is the cycle people mistake for failure of the body, when in reality it can be a medication pressure tissue loop. This is why daily or repeated steroid use becomes such a problem. The body gets used to a short-lived reduction in inflammation, but the original triggers are still present. Hard stools, pressure, straining, prolonged sitting, and poor toilet habits. Hemorrhoid guidelines repeatedly emphasize avoiding excessive straining and extended time on the toilet, because those habits keep mechanical stress on the tissue. So the rebound is not just, the hemorrhoid came back. Often, the pressure came back, the tissue stayed fragile, and the symptom returned into a weaker environment. That is why the same tube keeps getting bought, and the same frustration keeps coming back. So here is the whistle-blower message. Hydrocortisone is not the villain in the sense that it instantly destroys tissue, but it is absolutely not a harmless long-term fix either. Used repeatedly, it can thin skin, reduce structural support, and leave delicate tissue less resilient, especially when the real driver, like pressure from constipation or straining, has never been corrected. And this is the exact point where people need to change strategy. Not panic. Not shame. Strategy. The next chapter is where we stop chasing symptoms and start lowering internal pressure, supporting digestion, and protecting vascular integrity from the inside out. Always get rectal bleeding checked by a doctor, especially if it is recurring, changing, or unexplained. Here is the turning point. You cannot calm a pressure problem with a surface-only approach. Hemorrhoids improve when stool is softer, straining is reduced, toilet time is shortened, and the daily mechanics stop repeatedly forcing the vascular cushions downward. That is why official medical guidance keeps coming back to the same themes. More fiber, more fluids, less straining, and less time on the toilet. So the goal is not to chase the flare all day. The goal is to change the environment that keeps creating the flare. That means you are thinking about bowel mechanics, hydration, and habits, not just what tube sits in your bathroom cabinet. A root cause plan is not mystical. It is mechanical and digestive. Fiber helps keep stools softer and easier to pass. And reputable guidance from NIDDK and NHS sources recommends increasing fiber and fluids as a core first step for hemorrhoids and constipation-related strain. That is why a structured blueprint can be helpful. A clear plan can turn vague advice into daily action. How to build meals that support regularity, how to avoid overstraining, and how to stop spending long minutes on the toilet waiting for a bowel movement that is not ready. NHS-style guidance even recommends limiting toilet time and avoiding straining, because those habits keep the pressure cycle alive. Let me say this plainly. The bathroom habit matters. Staying on the toilet for too long, pushing hard, or going back and forth repeatedly can increase the pressure that irritates hemorrhoids. Public health guidance consistently recommends not straining and not lingering on the toilet, because these are modifiable triggers. This is where people often feel frustrated, because they were never taught that bowel habits are part of treatment. But once you understand the mechanics, the strategy becomes less frightening. You're not fighting your body. You're helping your body stop being trapped in a repeated pressure event. This is why an educational blueprint like Hemorrhoid No More can be positioned as a lifestyle adjunct rather than a replacement for medical care. The value is in organization. Helping people focus on fiber, hydration, bowel habits, and pressure reduction in a way that is easier to actually follow day after day. That kind of structure can be especially useful for people who feel lost, ashamed, and stuck in the same flare cycle. And I want to be careful here. No book, video, or supplement should replace an evaluation when there is bleeding. Always get bleeding checked by a doctor. Especially if it is recurrent, unexplained, changing, or associated with pain, weight loss, fatigue, or a change in bowel habits. Rectal bleeding is not something to casually self-diagnose online. So the message is simple. Stop thinking in terms of, how do I numb this for today? And start thinking in terms of, how do I reduce the pressure that keeps creating this tomorrow? That means softer stools, less straining, less time on the toilet, better hydration, and a routine that protects vascular integrity instead of irritating it. Those are the habits that change the terrain. In the final chapter, I'll bring all of this together and leave you with one grounded takeaway. The goal is to create a body environment that is less pressurized, less irritated, and far less dependent on steroid creams. Take a breath and zoom all the way out. This is not about being bad at digestion. It is not about failing. It is about a body that has been under repeated pressure for too long. Hemorrhoids commonly flare when constipation, straining, and prolonged toilet time keep stressing those vascular cushions again and again. The path forward is not panic. It is pressure reduction, bowel regularity, and tissue respect. That is the real shift. So stop thinking of steroid creams as your long-term rescue plan. They may briefly quiet inflammation and itching, but they do not rebuild strength, and repeated use can thin delicate skin and reduce resilience. That is why the label warns against ongoing use when symptoms persist, and why recurring bleeding should never be ignored. You are not meant to live on a tube of cream. You are meant to change the environment that keeps creating the flare. That is why an educational blueprint like Hemorrhoid No More can be framed as a lifestyle adjunct, not a replacement for medical care, but a structured way to focus on fiber, fluids, bowel habits, and pressure reduction in daily life. For many people, the hardest part is not knowing what to do next. A clear plan can make the next meal, the next bathroom trip, and the next day feel more manageable. And again, if bleeding is happening, recurring, or changing, it still needs proper medical evaluation. So here is the final takeaway. Stop weakening delicate tissue with endless steroid cream use. Stop letting pressure build day after day, and start protecting your digestion, your bowel habits, and your vascular integrity from the inside out. That is the safer, smarter direction. If you want the educational blueprint, check the link in the description. This video is for educational purposes only. If you experience rectal bleeding, you must see a doctor to rule out serious conditions like colorectal cancer. Do not self-diagnose based on a YouTube video.